Hello and welcome. My name is Jason and I'm the owner and founder of Reforming Trauma Coaching and Counselling. Today we're going to be having a look at the benefits of schema therapy. Let's go. Schema therapy helps people to identify their core emotional needs. It helps them to identify and understand their subsequent maladaptive schemas that have developed in response to certain needs not being met. It can help people to understand the mode that is activated when a particular maladaptive schema is provoked, a child mode, for example. I will explore those modes in a separate video. And it also helps people to understand the way in which they cope with the schemas and modes once they have been activated. Once you understand the core components of schema therapy, it becomes easier to understand why it is a combination of other therapeutic approaches. The CBT aspect, so the cognitive behavioral therapy aspect, focuses on the relationship between thoughts, feelings, and behaviors when each of the maladaptive schemas, modes, and coping styles are activated. Gestalt therapy emphasizes personal responsibility and the present moment, so focusing on what is actually happening within the present moment, identifying which schema, mode, or coping style is currently activated. Likewise, the object relations component focusing on how we interact with certain objects within our mind, the punitive and demanding parent objects, the child objects, etc. The attachment therapy component helps us to understand how relationships can activate abandonment, dependent or mistrust abuse schemas, for example, and also helps us to understand how the activation of these schemas then affect our ability to touch and interact securely with other people. Finally, emotion-focused therapy teaches healthy emotion regulation skills, which can be used when maladaptive schemas and modes are activated. Rather than relying upon the three maladaptive coping styles, so surrender, avoid, and overcompensate, the emotion-focused component of schema therapy helps people to accept and tolerate and eventually overcome their painful feelings and thoughts. Once a person understands the connection between these four aspects, they can begin to change their patterns of feelings and behaviors, confront their unmet emotional needs in healthy, adaptive, and constructive ways, and learn how to cope with frustration and distress when certain needs are not able to be met. This is not always easy, and it can be a hard, long, and frustrating road to travel. It can take many years sometimes. A good therapist, however, should be able to make a journey a lot easier and will save you a lot of time and distress. There we go.